name is Julian Johnson, and I worked with Sam Thomas, Hassan Mackay, Dr. Catherine Guardado, Dr. Aaron Hess, and our principal investigator, Dr. Raul Vedia. The name of our project is Subcutaneous Locked Plating, Radiographic Parameters in Distal Radius Fracture Management. Distal radius fractures are among the most common fractures in adults with a rising incidence worldwide. While many treatment modalities exist, volar plating is a type of open reduction internal fixation that has emerged as the predominant surgical technique. Volar locking plates have shown to be effective to achieve and maintain reduction. However, these plates are associated with a notable complication rate, reported as high as 16.5%, including nerve injury, tendon irritation, and complex regional pain syndrome. Dorsal distracting plates have demonstrated comparable clinical and radiographic outcomes to volar plating for specific injuries, potentially reducing complications, but concerns still exist regarding extensor tendon irritation and stiffness in the digits. Subcutaneous lock plating is a novel dorsal technique that modifies the distal spanning approach. The plate is positioned subcutaneously, superficial to the extensor compartment along the second or third metacarpal. This technique is designed to minimize soft tissue disruption, reduce the incision size, and preserve periosteal integrity. This facilitates a faster recovery to reduce complication rates compared to other techniques. Our methods included 15 patients with complete articular distal radius fractures, classified as 23RC according to the AO-OTA classification system. They were all treated with the subcutaneous locked plating technique. Surgeries were performed by U.S.-trained orthopedic residents or attendings under the supervision of a fellowship-trained orthopedic trauma expert. Radiographs were obtained preoperatively and at the final follow-up to assess changes in key parameters. The parameters were measured using the Detroit Bone Setter app, a validated tool for precise orthopedic radiographic analysis. Disabilities of the arm, shoulder, and hand, otherwise known as DASH scores, were obtained at the final follow-up, with higher scores indicating greater functional impairment. In our results, post-operative radiographs demonstrated that there was a statistically significant improvement only in articular step-off. Other improvements included radial height, ulnar variance, radial inclination, and volar tilt. However, these improvements did not reach statistical significance. The mean DASH score at final follow-up was 29.46 plus or minus 18.29. As you can see on the PowerPoint, we have on the bottom left in the middle, a radiograph of the initial presentation of the fracture, a middle radiograph of the subcutaneous locked plate, and a final radiograph of the healed bone after the plate has been taken out. To discuss, subcutaneous locked plates restore distal radius parameters within or near acceptable tolerances, with minimal disruption to the soft tissues. Patients demonstrated lower DASH scores reflecting better functional recovery. Variation in DASH scores reflects individual differences in rehab and post-op course. These results demonstrated that subcutaneous locked plating is a successful, more minimally invasive treatment for complex distal radius fractures, reducing the incidence of extensor tendon tenolysis without compromising fracture alignment or maintenance. Thank you for listening to our presentation.